In polycythemia vera, we have significant developments in the last couple of years, and this is a relatively short time period for this disease to have such novelties, because we know that 65 years ago we have identified disease as is, as we call it right now, and not much have happened for all these decades, and now we have several developments. And one that is in fact more recent is a new modified way of diagnosing polycythemia vera. The thresholds for diagnosing PV based on the presence of high red blood cell count has been lowered. This is disease that comes with high red blood cell count, but the threshold for diagnosis has been lowered to account for our ability to identify patients with so-called masked PV. These are patients that may have already iron deficiency that is usually present in polycythemia vera patients and lowers the red blood cell count. Sometimes we see patients with lower counts and have iron deficiency, so this is a situation where we call it masked PV. That led to modifications of diagnostic criteria. That's one. And the second most important part of a modified diagnostic criteria is a need for a bone marrow biopsy. This is usually then accompanied by testing for a JAK2 mutation, and we have two JAK2 mutations to talk about, JAK2 V617F or JAK2 exon 12, and the last one is the low erythropoietin level. So combination of these four factors leads at this time and age to a proper diagnosis of polycythemia vera. Again, very important to understand lowering the threshold in red blood cell count, this is hemoglobin and hematocrit, that leads to identification of such patients.